Well, I'm 71, and I guess it's looking back over experience with doctors. It's kind of interesting. My dad was a surgeon, urologist, well trained. But just the same, I think that it's going to go over a few things about doctors. I remember in high school, I was in football and I had an injury to my ankle, and they took a x-ray and said it was just a sprain and sent me home. And after a few days it was clear it was not a sprain, and my dad sent me back for some more x-rays, and it turns there's a crack going up my leg from my shin about 3 inches long. Well, I think another thing that happened that I was seeing a psychiatrist for just working out some problems that I'd had in childhood, that kind of stuff, and I had an onset of the of bipolar 1 while I was seeing her, and she classified me, diagnosed me as being schizophrenic, and also my mother. Well, she had never met my mother. She'd never had any contact, phone call, email. Of course, they didn't have email then, but no contact, never even saw her at a distance. My mother had never even been in the town, the city. And so with the onset of bipolar, I was in the psych ward, and her husband was there. And of course, he read her report, and he didn't examine me, but he prescribed Haldol. Well, after 5 days of that, I mean, it was clear to me that that was just terrible. And I said that to him, and he said, "Well, no, that just means what's happening to you just means you need more Haldol." So anyway, I dropped him, and he sent me a letter that saying he discharged me because of lack of compliance. And then, so I went to another psychiatrist because I was still having these symptoms, and he prescribed Novain. Again, he read the report that I was schizophrenic, and he didn't bother to examine me either, and prescribed a neuroleptic, and these were like Thorazine, Stelazine, Novain, Haldol are all of the neuroleptic families, and it's what you use to treat schizophrenia. Well, finally, after a year or two of this, I got to a physician who talked with me for like 45 minutes. He says, "I don't think you're schizophrenic." He says, "I think you're bipolar, and so here you go. Try this lithium prescription and see how it goes." And so literally within 24, 48 hours, I was back on an even keel, and it was clear the misdiagnosis by these three previous psychiatrists who were well trained. John Hopkins, two of them, and intelligent people, but it almost cost me my life. Literally within a hair's breadth, the Novain almost cost me my life. So you just have to pay attention to this. And so I'm on lithium, and I go to my general practitioner to get prescriptions. And this is not a good idea, as it turned out, because even though I was right in the middle of having delusions and was in a very serious manic phase, he didn't recognize it. And I ended up in the hospital, and I kind of learned my lesson that you don't use a general practitioner when you need a psychiatrist. And of course, he didn't notice. Well, then regarding weight, at another doctor at another point, I was at 286 pounds. I'm 6'1", and this was a bit heavier. I was, 14 pounds from being 300, which is considered pretty fat, obese, and he didn't say a word. I subsequently lost weight to about 253, And he said, well, you see you've lost some weight. I don't want you to lose any more. And, I was totally dissatisfied with 253. I mean, and here he was saying that. So I lost some more weight down to 230. Okay, so this is 56 pounds down from the high within like 14 months or so on. And he said nothing. He said nothing. My labs were coming in better and everything, but he well trained, but clearly not really paying attention. And then that same doctor, of course, I was on lithium, and at the time I started working with him, like 18 years ago, I didn't have any chronic kidney disease, but I developed it because I developed a toxicity to lithium after about 15 years. I've been on it for 15 years, and 15 years after being with this particular physician, I kind of go, well, I didn't know I could get kidney damage from lithium. Why didn't somebody tell me? So also very curious with this doctor. He's also, I noticed in his notes at one point, on 3 separate visits, that he said the discussion was schizophrenia and everything was going well. And I said, what are you talking about, schizophrenia? I never discussed that with you. I mean, that was on the West Coast, and you're on the East Coast. How did it ever get back here? Why did you? I mean, that was misdiagnosis with schizophrenia like 30 years ago. But how did you? And he had no explanation. And so anyway, he removed that from the records, this is very serious. Because if I were unconscious and I were treated for schizophrenia with some of these neuroleptics, it just would be really, really bad news. Well, psychiatrists are kind of nuts. There was another guy, I was on lithium, he wanted me to try Abilify. So I agreed, and it was clear after 2 weeks that Abilify was really not good at all. And so I said, I need to go back on lithium. He said, I'm sorry, I'm not going to give you any more prescriptions for lithium. You either go on Abilify or nothing, And so again, the same thing like Haldol, you have to do what I tell you to do, even though he didn't examine me, what was good for me. So that was just another case. And then there was another time, so eventually I got to Seroquel, quetiapine, and I was having an issue with some mania, and I had mirtazapine, and quetiapine affects certain functions of the brain when you're in mania, or stabilizing there, and mirtazapine does something quite a bit different. Kind of does a straitjacket kind of. It imposes kind of a psychiatric coma on certain processes of the brain, which is very valuable so that those processes can restore themselves. And I indicated to this doctor that I needed some mirtazapine. I'd run out, and she said, I'm sorry, but it doesn't do what you want, what you're saying it'll do. Seroquel does, the quetiapine does that. And, she was so sure of herself. All these doctors, they think they're right, And here I am telling her that I have the experience. I know this is what I need. And so I couldn't get it from her, so I checked myself into the hospital in order to get it. See, sometimes doctors are just completely off base and they don't even have a clue. In fact, the doctor who misdiagnosed me as schizophrenia in the beginning met me some years later, and she said, well, what happened to you? And I said, well, I got lithium and everything got straightened out. And she says to me, geez, I didn't know lithium would work for schizophrenia. The evidence is right in front of them, and they're totally nuts. Sometimes, and they think they're right, and your life is on the line. I don't know what's the matter with these people, not examining the person in front of them. And then there was another psychiatrist who I was seeing, about every 3 months, for just prescription renewal. And I had a med pack from the coming from the pharmacy, and of course all my pills were in there, and I just opened it up for morning and took what was there. And I noticed something very peculiar, and so I just thought, well, I better check to see if anything in the med pack has been changed. Nobody has said anything, and sure enough, this psychiatrist had included Ambien and an antidepressant, and we hadn't even had a visit during that period of time, and he never discussed it with me. And Ambien, I could have told him it was just as bad as any of the neuroleptics, even though it's not. And I'd had an experience with it some years earlier, and I just discovered it by accident that he had done this. And why the antidepressant, I don't know. But I stopped taking that, and I got him to take it out of the med pack, and it's just another. I don't know what got in this guy's brain. And then there was a therapist. I mentioned how I had, was kind of satisfied in my life because I'd been successful so many times, and he just kind of scoffed and said, "Successful? So what are you talking about?" And you see, he didn't know what I was talking about. That was his impression of me. But he didn't ask me, well, so what are you talking about? See? And there was a psychiatrist around the same time, and I was saying how, my father had made some contributions to science and such, and I had hoping to make some contributions myself. And he said, well, geez, you're getting kind of old to be thinking about, actually doing something like that now. These are mental health professionals. And they're so sure of themselves. You can imagine if you take their opinion. And then I stopped going to see a couple of these healthcare professionals, and they never called me. Like, where are you? Never called me. And in one of the cases, the guy, he'd been 3 months in getting a letter of evaluation that I needed, 3 months. And I had to write a very stern fax to the clinical director saying, somebody go down to his office and get it out of his hands, off his desk, and get it faxed to me, And, the next day he faxed it to me, never a word of apology or anything. I mean, just some of these healthcare professionals and doctors are just, I don't know. And then there was a general practitioner, and we were talking about depression. They were questioning about depression. I said, why don't you take that out? Because I'm not depressed. And he says, you're manic depressive. Get it? And I said, look, this is kind of arcane language. It used to be called mood swings, because from the outside, that's what it looked like. That was the closest thing people could identify with. And then it was called manic depressive, because they kind of saw that there was a certain class of things they saw as moods, as manic and depressive. And then it evolved to being bipolar. In other words, a couple of things were happening. Maybe we don't want to call it manic anymore or depressive, but we're going to call it some kind of thing that's happening in one area and it's coming, or it can swing back to the other area. And it turns out there may be a fundamental cause that's activating both of those, depending on which camp you're in. You're getting overstimulated in mania. You're getting overstimulated by the same chemical in depressive, as it's being said. But I don't really think he understood what I was saying. But bipolar, there are some chemical issues and certain processes of the brain that hasn't been thoroughly analyzed to understand exactly what is causing the overstimulation in either one pole or the other, if you like to call things bipolar. And then there was this same guy came in one day, and I was trying to get him to write the prescriptions for a blood pressure medicine that currently the med provider for psychiatric medicine was doing. I wanted it to be with the proper healthcare provider, and the blood pressure medicine would be better if he prescribed it. I'd been having trouble getting through to the pharmacy, and was waiting for him to come into the exam room to begin the appointment. And I was on the phone with them, and I was waiting, and he walked in and saw me on the phone and told me very abruptly, turn that thing off. And I said, I'm waiting. He said, well, turn it off. I'm busy. And I'm going, I'm just totally insulted, by the rudeness of this guy, because I'm trying to straighten out a prescription for him. So he's writing the proper prescription. Just the arrogance of this guy, and the fact that he's busy. I booked this appointment a month in advance, and to walk in, and I'm trying to straighten out a prescription for us so the records are correct, and he said he's so rude. God, I just couldn't believe it. And then there's one I saw, a new general practitioner, and I'd had sleep apnea, and but what I was asking her about was that when I went to sleep on my side, I wasn't bothered by sleep apnea, but my mouth would close, and my nose is kind of stopped up. I had an accident when I was a child, and I got a deviated septum, and it's often stopped up, and I really can't breathe adequately out of it with my mouth closed. And so when I drift off to sleep, when I'm on my side, my mouth closes, and I have to wake up again, and it has nothing to do with sleep apnea. And I mentioned that, and she said, well, you should go back on the CPAP machine, and she was adamant about, you need to go back on the CPAP machine. Well, the CPAP machine doesn't open your bloody mouth. You have a face mask, and it doesn't open your mouth. And a CPAP machine, I'd had a CPAP machine, and when I was sleeping on my back, and it was useful for that, to keep the airwave open. But on my side, I didn't need the machine, but I did need, I was thinking, geez, the hockey players have something they put in their mouth to protect their teeth. And I was thinking, God, if there was something I could do like that, it would just keep my mouth open enough to breathe adequately. And she insisted on, go back to your CPAP machine. And that's just a bloody ignorance. And that's the deal, is that, these are just some incidences that I can remember. So I think that you need to keep an eye on your treatment and make your own judgment, because the doctors they're so intent on executing the techniques and knowledge that they've crammed into their heads that they are so blinded that they fail to examine adequately the patient in front of them. They'd rather say things that they're so sure of, and they don't take the time. They've forgotten how to investigate a patient on their own. They just trying to get through their schedule, get things wrapped up, give a treatment, take care of things, and they don't really investigate very well the conditions of the patient and the medications that they're taking, I think, adequately. And so as you see, so many instances that that this has happened, and these are with well-trained physicians and healthcare professionals, by and large, and they're all making very serious errors in judgment when all they had to do was examine me. I mean, that's what it boils down to. And the question is, why is this going on?